I really think medicine chose me. I do not have any physicians in my family. I excelled in the sciences, and I loved communicating and connecting with people to solve problems. And I think the thought about disease-modifying agents and novel therapeutics is what drove me to work at Dana-Farber in clinical research. And that's what really solidified my journey to become a medical oncologist. A medical oncologist is a physician that gives IV chemotherapy or oral chemotherapy or immunotherapy to patients with cancer, but it's really a multidisciplinary approach. It is truly a team effort in terms of nursing, advanced practitioners, our interventional team, our radiation oncologists. There's so many different facets of oncology care, from patients walking in to see our medical assistants to ending their visit with my administrative assistants to really kind of envelop their care. So it's not just about the conversations with patients and me in the room, but it's about that whole team. So as a medical oncologist, I'm really proud of being an osteopathic physician. And really, it's about the philosophy. It's evidence-based medicine, but we work with a philosophy of the body as a unit, body, mind, and spirit, and this is what brings about health. So I'm really motivated in patients with cancer and their care to talk about what brings about health and kind of working in that body, mind, and spirit connection. I think one of my favorite collaborations is our Dana-Farber collaborative. I think every year, for those of us that can go to the American Society of Clinical Oncology, where we are presenting in Chicago the latest, the greatest, the best new therapies to modify and change the disease and affect patients in a positive way. So that's something that's really exciting, that we are meeting on a national and a worldwide basis to talk about patients, therapies, and potential cures. My patients are teaching me every day how strong they are. Whether it's a mental challenge, a physical challenge, they are always up and motivated to receive these challenges, and often with grace and compassion for others. And that's just so rewarding to see, and it makes me feel I'm so honored to take care of patients. I love this philosophy, and I've used it since medical school. We wore a pin that said, "It's about the patient." And so I think that's a really great way to focus your day every day, because it's not just about the patient's cancer and their chemotherapy regimen, but what drives them, what motivates them, how their families are involved, so that we can kind of reflect on challenges and meet successes together. Really rewarding to be working with patients, and I really stress that they are in the driver's seat and whoever they want in the passenger seat, me in the back, so we are coaching, we're communicating, and I love learning about their family. I love what their hobbies are, and when patients meet me, they've got to be prepared to tell me about their dog, their grandkids, what their hobbies are, because that's really making a great connection in something that patients are really vulnerable and scared about. I absolutely love baking and more cooking. So I'm a huge fan of Chef's Table. And so when I can watch some TV shows and make a recipe for my family, that's really bringing me joy at home.